Hello, everyone, and wherever in the world you are watching this from, a warm welcome to this discussion about the impact of the COVID-19 pandemic on mental health. In the next 90 minutes, we're going to be discussing the extent of that impact, how it's manifesting itself in relation to different groups of people, the vulnerable, those with pre-existing mental or physical health conditions, those grappling with relationship or family issues which are exacerbated at this time, those who have been bereaved, those who are recovering from the virus, and really on all of us amid lockdowns and perilous economic situations and outlooks almost across the entire world. My name is Mishal Husain, and I'll be moderating this discussion, which is part of Qatar Foundation's Education City Speaker Series. That is a series of discussions that brings together top experts with questions from the public. And this is also taking place in collaboration with WISH, the World Innovation Summit for Health, which is Qatar Foundation's global health initiative connecting practitioners, healthcare leaders, and also innovators. So welcome to you all. The format is going to be that we will have about an hour of discussion between our experts and then about another hour of your questions, which are already coming in from different parts of the world. So let me first give you a brief bit of information of how to submit your question at any point during the course of this discussion. If you are with us on Microsoft Teams, you can send in your question by clicking on the blue Ask a Question button, which should be in the bottom right-hand corner of your screen, and you can include your name or leave it out, whichever you wish to do. If you are watching on Facebook or YouTube, you can simply leave your question or comment below the live feed as you would do at any other time, and we'll be monitoring those and using them in the course of the discussion. Also, if you are watching on Microsoft Teams, you have the option to put up subtitles to this discussion in English, or to do subtitles or live translation in other languages, Arabic, Italian, French, and Spanish. And you can do that by going to the settings button on your screen. Any questions or comments you submit, though, please do so in English, because that is the language that the discussion will be taking place in. So let me turn to our experts and introduce them. Very grateful for the time that they're giving us today. First to Dr. Deborah Kestel, who's the Director of Mental Health and Substance Abuse at the World Health Organization. Last year, the WHO launched an initiative aimed at expanding mental health coverage to 100 million more people by 2023, which is part of accelerating implementation of mental health initiatives in WHO's work. She's with us from Geneva. Welcome, Dr. Kestel. Thanks for being with us.
A pleasure being here.
Also joining us is Paul Farmer, who is the Chief Executive of the UK mental health charity Mind. He's been involved in work for the British government, for example, on mental health in workplaces, and he also authored the 2018 WISH report on anxiety and depression. Welcome, Paul. You're with us from London. Dr. Janice Cooper, a Senior Project Advisor for the Carter Center Mental Health Initiative. She worked a lot on her native Liberia's Ebola outbreak and the impact of that, including on healthcare professionals suffering from PTSD. And she has also been the Director of Child Health and Mental Health at the US National Center for Children in Poverty. Welcome, Dr. Cooper, and you're with us from Monrovia today.
Thank you. It's a pleasure to be here.
Joining us from Doha is Dr. Sharifa El Emadi, Executive Director of Doha International Family Institute. It's part of Qatar Foundation. It works to advance knowledge on Arab families and promote evidence-based policies. Dr. El Emadi is a clinical psychologist who's worked a lot on behavioral disorders, especially drug addiction. Welcome, Dr. El Emadi.
Welcome. Thank you, Mishal. Thank you. Happy to be with you all.
Thanks for your time. Now to Paola Barberino, who's Chief Executive of Alzheimer's Disease International. That is the umbrella organization for 102 Alzheimer's associations around the world, and they all work to support people with dementia and their families. And she's with us from London. Welcome to you, Paola Barberino.
Thank you, Michelle. Lovely to be with you all today.
And at a very early hour in the United States, North Carolina to be precise. I'm delighted to be joined by Yasmin Mogahed, who's a very well-known writer, public speaker, writes and speaks a lot on Islamic psychology and spirituality. Her books include Love and Happiness and Reclaim Your Heart, which has been described as a manual to provide a new perspective on love, loss, happiness and pain. Welcome to you, Yasmin. Very early in the day for you.
Thank you. It's an honor to be with you.
So just a reminder that you can send in your questions at any point in the discussion, but I'm going to start with Paul Farmer, and before that with Dr. Kestel from the WHO to really give us an overview of what we are seeing in different parts of the world and in different ways perhaps. But Dr. Kestel, the broad sense of what you are seeing in terms of the mental health impact of the COVID-19 pandemic.
Thank you, Michelle, for the question and the opportunity to join this information. We have foreseen what was coming in a way because we know that the current situation related to COVID generates from the very beginning fear, anxiety, the uncertainty about the future, the current isolation in many contexts or countries, the need to find alternative ways to homeschooling for kids or even teleworking for us or people facing unemployment, a number of issues that we could continue listing that we know generate some kind of psychological distress. And so very recently, last week, 10 days ago, we reached out to a number of partners to see what kind of information can we collectively gather at this point. And the numbers just confirmed what we were expecting. There have been some specific studies done, and I will give you some examples. For example, in one region in Ethiopia where they measure depression and the number of people with depression has increased, a threefold increased compared to a previous measurement, and right now is 33%, which is quite high for those of us who are familiar with those numbers. There have been countries that did surveys, national surveys, and again the numbers of people feeling with some kind of distress, without naming it necessarily, are going between 35 to 60, and I'm talking about national surveys that were done in China, in Iran, in the US. We have numbers such as Canada doing a study a few weeks ago about increase of 20% of alcohol consumption, and what does it mean for mental health. So what we are seeing is that what we suspected will come, it is actually happening, and is that the number of people going through this psychological distress has increased already and will continue to increase as long as the crisis will continue and the economical situation will also accompany, most probably.
Yeah. Paul Farmer, all of this is happening at a time when the medical system is under incredible pressure. And I want to bring in one question that we've had in from someone watching right away, because this is from Michael in the US. How can we ensure that people are getting the best mental health support at a time when healthcare systems are overwhelmed and mental health might not be seen?
Yeah, well, I think, Michelle, that the kind of challenge that the system faces, the mental health system is facing, is extreme. I think, as Devorah's correctly said, there are significant pressures on our mental health as a population level, as well as specific needs for specific groups. So we've seen, I suppose, in the first instance, an encouraging approach from people without mental health problems, people from the public seeking help and information for how to look after their mental health during the lockdown phase here in the UK. And I think that's a positive sign, because it shows that people are conscious and cognizant of the need of thinking about how to look after their mental health and how to pay more attention to it. But secondly, we are concerned, like as we've already heard, about those groups of people whose risk is increased as a result of the lockdown situation, whether that's people who are at the front line of this, the health professionals and others, whether it's the group of people who are experiencing greater distress because of their domestic situation. If you're in an abusive household or in a situation where you're not able to get the right kind of help and support, then that's an issue. And then thirdly, we've also seen an increase in poor mental health amongst people with existing mental health problems. Roughly 2/3 of the 12,000 people we've surveyed, people with existing mental health problems, telling us that their mental health is poor. Now, paradoxically, we know that referrals into the system are also going down. And so it's really important that there's a reconnection between mental health services and the need that is being articulated through effective referral routes, and also the need for the preparations to be made over the next few weeks so that mental health services are able to cope with what is unquestionably going to be a sort of mental health surge, if you like, in terms of the needs that are probably just around the corner. Now, these will take more time to manifest themselves, but I think we do need to ensure that systems generally are prepared for that kind of help and support.
Thank you, Paul. This is Nick at Wish. We've just briefly lost Michelle for a couple of seconds, so hopefully we'll have her back in a couple of minutes. I'm now going to jump over then to Dr. Janice Cooper, who's in Liberia, who can give us really, if we can ask you really to give us an idea of your experience having dealt with people who have had to deal with Ebola and the effect of doing that on the community and also on mental health of actual people in the healthcare workforce.
Thank you, Nick. I will start talking about healthcare workers, and what I think we can expect given our experience is initially an overwhelming desire to help because they have taken an oath and they want to follow that. However, closely behind that, I think you can expect three things based on our experience with Ebola. One is fear and fear-based behaviors, anxiety, trauma-related behaviors, people experiencing, healthcare workers in some cases even experiencing flashbacks to what happened during the war, and we have various stages of the war, which accumulates the trauma that they can experience, and definitely an instinct to walk away. However, I think that is mitigated by the fact that they have an ultimate urge to serve. And I think that for our mental health clinicians, they will be concerned and worried about their own safety and the safety of their family, and the concern that they may take the virus home to their families. So early on in our infection prevention and control, there needs to be a lot of training around mental health and what to expect in terms of psychological responses. In addition to really need to deal with people with pre-existing mental health conditions so that the outbreak does not trigger an episode.
Okay, I think, can everyone hear me? I think I'm back in the meeting.
Yes, you are. Thanks.
Great.
Sorry. This is Nick. I held the fort briefly, but I'm very, very happy to hand it back to you.
Thank you. I'm so sorry about that, everyone. The technology failed at a critical moment. So, Janice, I think you were just having your input. Have we heard already, Sharif Al-Imadi, from you?
No, still I'm waiting for you.
Okay, perfect. Well, perhaps you can fill us in, because your work is very much focused on the family. Give us a sense of the impact that you have seen on families, particularly those in difficult situations, but the impact that the pandemic is having.
Yeah, I think what my colleague said about the coronavirus and how it's caused the mental health for individual will impact on their family. So especially when we will see the previous one of the part of family have a previous mental health, that might increase this problem, and the family, especially when they will be the parents, they lead from to protect them, to feel more secure with their member of the family. So when they will see this impact on them, so that will cause a problem to all the family. Also, if we will talk, there is many issues related to work-family balance, like because we all lock down and we have to work together at home. Our children is studying, so this might even cause more pressure, especially in some culture in women, because she's taking responsibility of working from home, her work, and also pressure from the family that it's your job, it's your part to do and to finish all the tasks. So it's all pressure, and it's all can bring anxiety, can bring depressed. Also, we don't want to forget the member of the family that they have disabilities, like children, like autism. They need to contact more people, social, to let their children to be more social, and to work with them, like and do all the exercise with them. And now because they are locked down, so it's difficult for them to do that. We can hear, I can give you some percentage of the domestic violence that's happened during this COVID-19, like 30% increase in police intervention in Paris related to domestic violence cases. Also, 45% increase in India. What's surprising me that we heard from Kuwait that the number of the cases that going to the court and asking for divorce, it's decreased. And also last week, executive director of WIFAQ, which is Family Consulting Center in Qatar, said that even the conflict and the complaint about conflict or asking for help and counseling from couples that facing conflict, it's decreased. So I think we need to do more research in that, and that's why Doha International Family Institution it's conducting now research to see the impact of all these like the lockdown on family. Yes. And we can even explain more after other.
Yes. It's interesting to hear you talk about the impact in different parts of the world, because Paula, you get that sense from your organizations right across the world. Early on, what were the indications from the countries affected in the initial phase of this?
Thank you so much, Mishal. Yes, we represent 102 countries, and we started working from very early on, from January, February, with our Asian members, and China in particular, but also with Hong Kong, with Malaysia, with Indonesia, Singapore, Taiwan, Korea, Japan. And it was pretty clear from the beginning, from the initial lockdowns, that there were going to be issues in people caring for people with dementias and people living with dementia at any kind of stage. Because, of course, in many cases, we are seeing multi-generational families, so parents being in lockdown with children and with elderly parents that they are looking after. And we started seeing a real increase in the level of mental ill-being in some of these families who, in certain cases, were used to receiving care and psychosocial support. And at this moment in time, they weren't. So we started working on developing guidelines globally that could help people all over the world working out what was best to do in those kind of situations. But since then, a lot more situations have arisen. For example, we were alerted originally that in France there were issues with people living with dementia alone, wandering in the streets, for example, not understanding the social isolation and the consequence that was having on themselves and the public. Again, from Asia and the Caribbean, a lot of members reported issues about people with dementia being scared of people wearing masks, for example, caring for them, and also of general confusion about the situation, and they needed guidelines and advice on how to approach the issues, which we have done. Finally, there are other issues that are coming out. Families, unfortunately, are worried about COVID-19. And if they suspect that a person may have dementia, they are actually not seeking a diagnosis. And we think this gets back to what Paul was saying earlier, that there are consequences that are going to happen 6 to 9 months down the line when family will find themselves lacking that kind of psychosocial support. Certainly the withdrawal of care and social care systems all over the world is impacting very greatly. There are also a lot of lovely examples of people coping with that, though. We've had the great examples, one of them between all South Africa, one gentleman who was used to having his mother going to the supermarket every day as part of her routine. With dementia, he's created a corner of his home, a replica of this supermarket. People are coming with all kinds of wonderful ideas also to overcome the current difficulties.
Yes. Yasmin Mujahid, it was foreseeable, the mental health impact of all of this, and it is happening. What sense do you have about where and how people are searching for strength and for answers and for coping strategies?
Well, actually, one particular finding that I found very intriguing was that there was a professor at the University of Copenhagen who found, she recently published a report, and what she found, she writes that search intensity on prayer is flat before a country registers its first case of COVID-19. But then it drastically rises after the first case is registered in a country for all regions of the world. And she finds that this increase in prayer intensity documented here are the largest the world has experienced since 2004, the earliest date for which the Google Trends data is available. So what I found particularly intriguing by this is that clearly people around the world are turning to prayer, are turning to religion as, apparently a coping mechanism. So I think that what it really shows is that there is sort of this human condition where we look for purpose, and many people are turning to their faith traditions to find purpose in this feeling that they're having of vulnerability. Many people perhaps are facing their own, mortality and their own frailty as human beings. And so many people are searching to higher purpose and perhaps a higher power to help cope with that.
And a lot of people would be feeling, on the one hand, a real sense of helplessness, but also seeing people around them in worse situations than they are. And they might wonder if it's okay to have the feelings they're experiencing when you can see people who are suffering more.
Yes, I absolutely think that a lot of people maybe, struggle with this, you're feeling anxious and you're feeling concerned about your family and perhaps the welfare of your family. But at the same time, you are seeing on the news that there are many faring worse than you. So I think sometimes there is that internal battle of maybe a little bit of guilt and a little bit of feeling like, do I really have the right to feel what I'm feeling, which I actually think can be counterproductive, because one thing that we find with in psychology is that when you do not give yourself permission to feel what you're feeling, it can actually just make those feelings worse. And so that may be contributing to some of the issues, exacerbating the issues, because people don't really have necessarily an outlet, and nor do they feel maybe that they have a right to the feelings that they are experiencing.
Just a reminder to everyone who is with us, whether on YouTube or on Facebook or via Microsoft Teams, that through all of those platforms you can leave your questions and contributions, and I'll be putting them to the speakers throughout the discussion. I wonder, Dr. Devorah Castell from the WHO, if I can turn back to you, because how does the mental health dimension of the pandemic fit into the overall strategy from governments, from the WHO to fight this disease?
Thank you, Michelle. I think that slowly governments and agencies are realizing the mental health dimension of COVID-19. The priority is to save life, right, and to protect people from being ill and being infected, and but the role that mental health is having in all this, in social media and in a number of communications is gradually increasing. You know that we talk about mental health and psychosocial support as a comprehensive approach to problems that go to many of the things that the colleagues mentioned before, from the lightest distress that one can suffer to the most serious mental health issue. And it is an issue related to the health sector, but it is also an issue related to social care, of course, and education, and the government in general. We all have a role to play in when we talk about mental health and psychosocial support. So, as a matter of fact, then this kind of cross-cutting area is being included in, or there is an invitation for including it in national plans for COVID-19 response, in the context of the humanitarian approach within the UN to COVID-19. That is, if you look at the latest documents, you will see a lot of references actually to mental health and psychosocial support, and the same is from a WHO perspective. Our Director General is coming loudly with a message about do not forget mental health. If you follow, anybody following the press conference could have heard him many times, very early on time, for example, talking about we do not have to talk about social distancing, we need to talk about physical distancing because the social connectivity is important. And that's a message that came also from the senior level of WHO. So slowly, we hope that all countries will realize this and will join this common effort to put all these pieces together.
Paul Farmer from the mental health charity Mind, it was already difficult to get people to give parity to mental health alongside physical health. Do you think that job is harder when there is a disease such as this, a virus such as this afoot?
Well, I think there's two ways of looking at that. I think the optimist in me will say that for the first time, entire populations are beginning to understand what it means to have their mental health seriously challenged as they encounter situations in their lives that they've never had to encounter before, and realise that there are psychological consequences to being locked down, to have not being able to see their friends and family, and to have significant worries about work. So the crisis brings mental health closer to people, and so that hopefully means that citizens and governments start to take it more seriously. However, the pessimist in me recognises that there is then huge pressures on systems. So there's the pressure on the health system, which in different parts of the world already the starting point for mental health is not always a strong one. It's not the strongest suit in many countries' health systems already. So it doesn't mean you're starting from a good point. And if there's greater pressure on those health systems around a physical health issue, then mental health can be more marginalised. And then secondly, there's likely to be huge financial and economic pressure in countries, and the focus then becomes a debate between physical health and the economy. Now, I think, as we've already heard, that would be a grave mistake for countries to take that approach, because to leave aside the psychological consequences of this crisis will be to store up both financial and health consequences for potentially years to come. So I think this is a real crossroads moment in terms of understanding, thinking about how the progress that has been made in recent years around really raising awareness for mental health as an issue, to what extent is that then going to be converted by governments and by populations as we enter into this extremely risky phase for the mental health of our communities?
Okay, I want to turn in a moment to Dr. Janice Cooper and talk about the impact on frontline medical professionals. But before that, Dr. Sharif Al-Imadi, I think you wanted to come in.
Yeah, thank you very much. I just want to add to Paul that I think we are lucky. Psychosocial intervention, it's can easy to do it hotline or virtually. So we can contact our cases now normally, and we can talk to them. We can finish the sessions with them. So we are lucky in this part. Another thing I want to raise it. I think as a mental health and the stigma before this COVID-19, I think this will change, because now the importance of asking and seeking help to mental health, it's become normal, and everyone is seeking, they want to seek this help, especially that most of the countries, they provide a hotline for that, like Belgium, like Turkey, also Qatar. So I think this is good for even improve even the service, and this when we will decrease the stigma against support and mental health support. Thank you.
Dr. Janice Cooper, I wanted to put this question to you because it's come in from a nurse in the Philippines, Romnick, and the reason I want to put it to you is because I know that you worked with healthcare professionals amid and after the Ebola outbreak in Liberia. So here's the question. Even before this pandemic emerged, low morale and burnout were rampant among healthcare workers. Coping with COVID-19 has actually magnified the many challenges we face and added new ones, such as having to deal with limited resources in healthcare facilities. Worryingly, there have been several reports of suicide among healthcare workers. Is there any recommendation you can provide for employers on how they assess and better support the mental health of their medical frontliners?
Thank you, Michelle. Absolutely. I think, first of all, you have to be monitoring, especially your response team, but all of your healthcare workers, to see what the impact is on their mental health. You cannot assume that this virus that affects all of us, the fear-based behaviors and anxieties that come with it, affect all of it, that won't affect healthcare workers. So you definitely need to be paying attention to that. And you definitely need to be providing systems that are safe and confidential so that they can access mental health services. One of the biggest things is the stigma around mental health. And so healthcare providers do not want to be stigmatized to the point where they're not able to access mental health services. And one of the biggest surprises, and I would say a breakthrough for mental health during Ebola, was the time when a healthcare worker actually was infected. And when it was time for her to be having her confirmatory test to be released, she actually had a psychiatric episode. And the entire Ebola treatment unit was vacated by all the healthcare workers. It was a crisis in the system, but it brought to our government a recognition of the need for mental health and psychosocial supports all the way through the response. And not just to people who have lived mental health experience, but to the entire response, including those who are working in the response. So from that perspective, this is how we have tackled not only post-Ebola, where with help from the World Health Organization, we're able to train additional mental health clinicians in the area of child and adolescent mental health, as well as from the World Bank. But we're also able to do what's called Image Gap Intervention Guide, which Deborah can speak about forever, around healthcare workers having just some basic mental health skills so that they can intervene early.
Deborah, do you want to say something briefly on that? Because then I want to turn to...
I just wanted to... Thank you so much. I just wanted to complement something that to what Janice has said, and I thought the question was very important because on one hand is the responsibility of the healthcare provider, the health workforce, that they're under absolutely high level of stress and they do as much as they can. But they need to receive some information, some training, but also some information about how to take care of themselves. Mm-hmm. Having said that, managers need to know what needs to be done in order to prevent whenever possible, otherwise to provide support to their staff. And there are key basic issues about how is the communication being done, how the shifts are organized, how supportive and empathetic one could be with the health worker, how what kind of training can be provided to the manager, basic psychological first aid, for example, to the manager to realize that something may be not going well with the healthcare provider, and then what to do. What are the referrals? We know that there is a reduction of services, mental health services available out there right now, but there are some colleagues available, and how to reach out to them. So, in short, a number of issues that can be done and should be done also above the health workers in the entire chain of responsibility up to the top. Yes. Thank you.
It's interesting. There are lots and lots of questions coming in from people along the theme of what can I do to look after myself? And I want to put some of those directly to the panel in just a moment. But before that, Paola Barberino from Alzheimer's International.
I just wanted to complement some of what has been said by Janice and by Deborah in a different way. So the first time I was aware of some of the issues that were happening to our constituency during COVID-19, all the people have been hit by COVID-19 the hardest, were indeed coming from the Philippines, where one of our neurologists contacted us about the very difficult decisions that healthcare professionals had to make during triage on whether to treat senior citizens or not. And that has exerted a huge amount of toll all over the world. We have all read reports from Italy and France and Spain, actually, that have been very heartbreaking, and more recently from the UK. So I think, there is plenty of things that can be done around that. But we do need to be aware that in certain situations, healthcare professionals have been asked to take decisions that none of us would ever want to take. And in the case of some national guidelines, like the UK guidelines, we have felt compelled to actually write a paper on the ethics of people making those bedside decisions. Because I think it's an extraordinary situation, and I really do hope that we will learn in future, because there are issues of discrimination of particular constituency that we would have never, ever wanted to have seen, and we have seen, unfortunately.
Okay. Yasmin Mujahid, a question has come in via Facebook for you from Zubair, who says, down the line, we will have a cure to COVID-19. But how can we handle it from a spiritual perspective?
And that's a very, very important question that I think is becoming more and more evident how important that is to people. I think that from a spiritual perspective, a big part of it is seeing sort of the bigger picture, finding purpose within what seems like a random chaos. And I think the main thing that religion and spirituality gives to people of faith is that exact thing, is that it allows people to not all this and think that this is just chaos, that there's no one in charge, but rather people of faith see that it is overseen by a loving, merciful God. And that when you see what is happening around you in that way, it gives you a lot of sort of rest internally, knowing that it is not random and it is not meant to harm, but rather that ultimately this merciful, loving God is taking care of his creation, and people of faith find a lot of peace in that understanding. I think it's best explained in one concept that we have, for example, in Arabic called husn al-dhann billah. So in this concept of having a positive opinion of God, I think it's given a lot of people from various different faith perspectives, but basically seeing that that what is happening, that God is actually, what God does in our lives is happening for us, not happening to us. And I think that shift in perspective really gives people a lot of comfort, knowing that there is a higher purpose, and that it isn't random, and that God is actually in charge ultimately.
Dr. Sharifa, given your work on families, I want to put this question to you, which has come from Amal Samir, who's watching on YouTube. And it's about the needs of child mental health in a situation like this. What would you say that we are learning or seeing in terms of the impact on children?
First of all, I think, especially in our culture, like family units is still together, and with this lockdown, people can stay, or parents can stay with their children and understand their behavior more, because we used to raise the flag that we don't have time to balance between our work and family, but now we working in the family at the same time, working at home at the same time, we caring about family. So we have to look at our children, try to understand them. Communication skills is very important, because normally most of the conflicts that research shows that most of the conflicts because we don't have a good communication skills together, even with our children. So we have to know what our children think, to communicate with them, talk with them, explain for them exactly and the reality of this problem, but in a positive way, in their age, in the way that they can protect themselves. At the same time, they can not to take them to stress more. If we have problems with our children and we felt that they need a help, I think most of the country, as I said before, they have this still all the centers that providing mental health. It's open. They can go and ask for help. They can call, even like in Qatar we have 16,000. You can call them, and they will refer you to the mental health system, and you can take your children if they need intervention in that. But as a family, I think we can support our children by staying with them more, by playing with them more, by understanding their mental health more.
Paul Farmer, there's a question that's come in from Adam in the UK, which I think is put in a way that will resonate with very many people. He says, I still have my job and my family is in good health, but I feel overwhelmed by what's happening in the world, and the lack of control over the future is making me anxious, but also guilty. What can I do to feel better without overburdening others?
It's a really good question, and the uncertainty that this whole issue has created, this whole crisis has created, we know that uncertainty plays on our mental health, even though we know that in our own situation we may feel as though we're doing not too badly, really. So I think we've been offering a lot of information and support to people who are worried about the wider issues as well as their own specific issues through Mind's coronavirus information pages. And what we recommend in there are 3 or 4 very simple steps that you can take as individuals to really think about how you look after yourself and how you manage and cope with that uncertainty. And the first thing to do is to think about your daily routine, because this is sounds very basic, but it can make quite a lot of difference to your ability to be able to cope better with the levels of uncertainty by putting in place as much certainty as you can in your daily lives. So issues like, we know from all the advice and guidance from the World Health Organization that good sleep, good diet, physical activity are all important. The other things that we've been suggesting to people is to take some time away from the coronavirus crisis. It's so dominant in everything we see and do. It's dominating our work, on our news channel, on our social media feeds. That it's a really good thing, and we're hearing more and more people taking time away from that to focus on a hobby, or on your children, as we heard earlier, to focus on something that is completely away from the kind of day-to-day uncertainty. And we know that's really positive for building positive mental health. And be able to take some control of the things that you are in control of, which will minimize those areas that you're not in control of, because none of us know where this is going to end. So we have to build up our capability to be able to cope with what life might throw at us over the next few months. So looking after yourself, taking time for others, and also finally, talking about your concerns. Find a trusted person, a friend, a colleague, maybe somebody outside of your immediate home environment, where you can actually say or write in social media or others, or through other digital means, that you're concerned about how you're feeling. Because if we're going to make progress on the stigma issue, we hopefully will find more people being open and honest about how they're feeling about this situation. And that's not a bad thing, that's a good thing.
Dr. Janice Cooper, what are the common themes, but also how much harder is the position if you are in a developing country, or if you are a lower income or a marginalized group, or a group with fewer resources in a rich country?
Thank you. I think the first thing is thinking through how well your system already is built. And in our case, we've had civil war, we've had Ebola, and so our systems get built back, and then because of whatever the constraint is, it gets challenged again. So funding is there for a while for whatever the disaster is, and then when that goes away, that funding is not continued or replenished or kept at a level to maintain facilities and to maintain the healthcare workforce. So that's a definite huge challenge. I think it's changed a little bit. Certainly for Liberia, I can talk about how much has changed. And that's a result of having persons with lived mental health experience be able to speak out and articulate what their needs are and start to be empowered to represent themselves as voters who have a stake in what the political climate looks like. And that has changed some minds, and that has done something in terms of our political, creating more equity. I can't say that we're there, but I think that we're moving in that direction, and we need to have much more community-based mental health at all levels. So right now, we have some school-based health and mental health clinics in schools in Montserrat and Margibi, which were some of the hardest hit areas. And children from a very early age are beginning to understand how they can be well, be mentally well. And those who are having problems, whether it's problems from child abuse or neglect or problems with social emotional behavioral disorders, there is a mechanism to start and address that. But we need to scale these. We talk about these, but everything needs to be scaled.
Dr. Deborah Castell, there's a question from Franco, who's with us on Microsoft Teams. I think you mentioned earlier on about the data where it does exist about the mental health impact, but he'd like to know whether the data shows differences or similarities among countries, whether the patterns of what we're seeing are different or similar.
Thank you, Michelle, and thank you, Frank, for the question. Actually, it's a bit difficult because I don't think we have enough information from every corner of the world to do that comparison. We know that some of the issues related to the isolation that many countries have put their population on, what has been called as a lockdown, will have a different impact whether you are living in a big space, in a big comfortable house, a few of you, or whether you are really a lot of people in a very small home, right? I mean, that's going to be different how it's going to impact each one of us. On the other hand, some of the structures, pre-existing conditions of the health systems are different, of course, and so continuity of care for those who have pre-existing mental health conditions or health conditions in general, as well as the possibility to reach out more openly. I was listening earlier, Paul, talking about the advance in the fight against stigma, and this is, we know, is not common everywhere. It's in some countries, in some others, it's really still lagging behind. Globally, only 2% of the health budget goes to mental health nowadays. So there are not services out there everywhere, and not services means also not an easy possibility to reach out for help, including the remote support that was mentioned earlier, the psychological interventions done remotely. That's great whenever it's available, whenever people have access to that. So what happens when we don't have that capacity is that we need to find alternative ways. We need to find the community to jump in and provide support. So all of that will make maybe the lack of numbers to the answer that to the question that I was asked.
A few questions are coming in on isolation and the effect of isolation on different groups. Paula, from your perspective at Alzheimer's Disease International, could you answer this, which has come anonymously from someone who says, I'm caring for my husband with dementia. Who cares for me and the millions like me around the world? How can governments provide proper systems to prevent carers feeling so isolated?
This is such a massive issue. In our report last year, the World Alzheimer's report, it came up over and over again. Carers do desperately need support themselves. I mean, it's wonderful that people abnegate themselves to care after another human being, but we cannot forget the toll, the mental health toll on themselves. Well, in the case of this particular person, and I'm sure others that are watching, you really should try and reach out to your local Alzheimer's association. If you go to our website, www.alz.co.uk, you will find a list. Now, our members, as also some other speaker mentioned before, some of them, especially in lower income countries, are having huge issues with funding. So not only the government has cut the funding, whatever they had, but they also have having problems fundraising. Nevertheless, well, this crisis has shown us that there has been great resilience. So people are organizing themselves along lines that we never thought imaginable. They're using technology whenever it's possible to still convene carers group and still do local support of each other through those groups. So if you reach out to us, we can put you in touch with those groups. We can try and help you find a community near you that will enable you to at least find a glimmer of hope. And we find that people in rural situation or in marginalized community are particularly at risk. So be sure you are not alone, and there are other people out there that are working very hard to help you. And if help is needed, do reach out to us and we will try. But you must look after yourself. Respite is essential. As other speakers have said, exercise is essential. You need to feed yourself. You need to continue to keep your brain active. As Paul said, try and find the friends that you can confide to in the shorter period of time. So even if this is not technical advice, it will still help you maintain a level of sanity, which is essential right now. Isolation is a big issue. Many countries are talking of distancing to avoid using the word isolation. We don't want to be isolated. Very few human beings naturally want to be isolated. Yes. So you do need to try and get a way to communicate your feelings. Another speaker talk about feelings to someone else. Thank you.
I don't know where in the world this carer was writing from, but I know that you have 102 linked organizations. So, you know, hopefully in her country, it appears to be a woman, or, you know, perhaps somewhere she'll be able to access help. And at the end of this discussion, we'll be putting up a slide on the screen with some of the places that you should be able to find help and support. If you are watching this and you are grappling with your own condition or your own problem, there should be help out there for you. Yasmin Mujahid, it's a really interesting debate, not only on resilience and personal resilience, but on what this pandemic has done to societies around the world. In many ways, it's a humanizing experience. We see people working from home, surrounded by their families, their own domestic situations. We have an appreciation for workers all around us that we might not have had before. What do you think this has taught us about what our societies are about?
I definitely agree. I think one of the interesting things is, like, now that everyone is at home, all of a sudden these people that kind of we used to see as larger than life, for example, celebrities, right? We're seeing celebrities on webcam as well. We're realizing that, wait, you know, they're just as human as us. They also have chairs in their home, and they have, you know, same, you know, they have children, or they have, you know, family around, or so I think it's, as you said, it's very humanizing. And I think what it does, I feel that one thing that it's really done is it's put us all at the same playing field, in a sense, because we're all everyone is almost equally susceptible to this challenge. And of course, very, different, it affects different people differently, but no one is immune in the sense that it can touch anyone. And I think very early on, when we had, for example, the announcement of some of these celebrities, these very famous celebrities getting, like Tom Hanks and his wife, for example, I think it just really put things into perspective about the fact that we're all in this together, in a sense, and it doesn't matter your status, it doesn't matter how much money you have, you can't hire someone to keep corona away from you. You can't hire a bodyguard that'll keep this unseen sort of intruder from affecting you. So I think it's very humbling, and it's also very humanizing, and it kind of just shows us that we're all actually in this together as human beings.
Paul Farmer from the mental health charity Mind. There's a question here from Dr. Faisal Chowdhury, who's asking, are there mental health indicators that have actually improved? Some people suffering from burnouts have had the chance to take a breather and spend time with their families.
Well, it's definitely important to stress that this is not all bad for everyone. And I think some people have been able to benefit from, as you've heard earlier from other comments, from the fact of the benefit of having more time with your families and the ability to be able to maybe manage your work-life balance in a slightly better and different way from the way in which we've previously been able to do it. And I think that, although I don't think we've yet seen sufficient indication statistically about the change in population mental health, there are certainly groups of people who have been able to use this time to take stock of their own individual situation and be able to, as I said earlier, kind of think a little bit more about how they do look after their mental health, and maybe intervene from themselves about those places where which were previously damaging to their mental health. So I do think there are some positives that come out of this, and I mean, there will, in the workplace area where we've done a lot of work, there's a lot of debate about the positives of this kind of conversation being able to take place, a global discussion which we're all being able to have from our front rooms. What an excellent way of creating connection. And there's a much more micro level. We've seen communities coming together like we've never seen before, acts of kindness, acts of generosity to your neighbours and to your friends. In fact, finding out who your neighbours and your friends are. So there are definitely some positives to gain from this, but I do think we also have to recognise that there are certainly communities where the impact of coronavirus is exacerbating the inequality, and I think there's certainly increasing evidence for communities, certainly in the UK, from particular black and minority ethnic communities, those people who are already living in poverty. There is some suggestion that the kind of divide between of inequality is going to grow as a result of coronavirus. So again, I think there's a really interesting challenge for the way in which we think about the sort of social contract we have for our mental health, where those people who have been able to cope perhaps better, perhaps there's an increasing opportunity for people to be able to reach out to those people who have been either more affected physically or mentally by the crisis, to create a more equal society rather than expand the reach, grow the depth of inequalities in society.
Dr. Sharif Al-Imadi from the Doha International Family Institute, on this point about the benefit of us spending time together as families, you said it right at the start, pointed out the impact on women in particular through all of that, where you are, often you might be working from home and you're going to be overseeing schooling and meals and all the rest.
Yeah, first of all, I want to mention that we will be unfair to talk about all the countries like each other, because if I will talk with about our culture, still we have big house, we have indoor places, which is some countries they don't have these places, or in the same countries we will see people in the small flats. They cannot go out. The children, they suffering. They even cannot do moving stuff. But I think parents, if they are positive, they want to work together to support their children. They can create activities and create many things. They can, depends on what they have and how they can do this. So the benefit of this, we used to flag in the UN even, because they always, we talk individual about women, children, disabilities, or everyone by himself. While now we want to know the importance of the family unit. I think in this pandemic or the lockdown, everyone knows that the family it's very important now. A nuclear family and extended family. So I think now this is also will give opportunity for others to understand the importance of parents for their children, importance of everyone to work together. So I think it's mother and father, both of us, both of them. And we can see even videos or some in the social media that we use in our culture. It's difficult to see male going and cooking or cleaning, but we can see these things. So this, again, like Yasmin said, that's a role model of the people that they used to see something, it's not acceptable, now it's acceptable. So they have to help each other. Also, we heard that some parents, it's first time involved in their children education. They used to they don't even deal with the schools, but now they working with their children and they teaching them, so they involve more in the life of their children. Also, I think in our culture and Qatari culture, we can see that they brought even old or cultural kind of activities, and they bringing these backs to work together, because another issues might be negative, that our children just sit behind the social media and internet, and they might be addicts to these things, while we don't want them to be addicts to these kind of social media. So again, we can bring them to play sport together, to do different activities together. Everyone can do it, can create based on what they have, what they provided. So this is, I think, one of things that we can do it together.
I want to thank everyone who is sending in questions, whether through Microsoft Teams, whether on YouTube or on Facebook, because lots of them are coming in. We still have half an hour to get through as many of them as we can with the panel. Let me take it right back from the family up to the policy level and turn to you, Dr. Deborah Castell of the WHO on this one, because Heather has this question for you. When designing plans around controlling virus spread, do you feel that governments are considering the immediate and long-term mental health impacts of COVID-19 lockdowns and the death and suffering related to this rather than to the virus itself?
Thank you, Heather, for this question. I mean, it is very important, and somehow we talked about it earlier a bit when we say that we hope that this is going to be happening, when we said that many countries are doing or updating regularly their plans for COVID-19 response. And we do hope, and we are working from WHO, and I'm sure many of us there as well, we are working in order to make sure that mental health is part of any recovery plan. We need to make sure that there is a recovery for mental health as well. And as it was said, not everything is about the current isolation. The situation goes way beyond that. The situation has to deal with all the issues that have been mentioned in terms of the sufferance, the death, the unemployment. We are already seeing a big impact in the economic situation in every country right now in the world. Of course, countries that are well off or better off will have capacity to manage from the government that economic turmoil differently than others. But in both cases, we need to make sure that there is a mental health system in place to be able to support the population in that moment. If you recall, when there was the big economic crisis in 2008, around that area, there was some studies in the US about the number of what were called death by despair, the suicide, substance use increase, because of the unemployment and the uncertainty that was also mentioned again earlier. So we are advocating, and I think we need to increase that the sound of the advocacy, the voice around that, for the inclusion of mental health in any recovery plan. And we need to make sure then that we build back better. We build mental health services, mental health systems, mental health care for the population, even in those places where before it was not.
Yeah. Well, on that note, Dr. Janice Cooper, I'm conscious that you in Liberia, and you personally and professionally in the work that you've done, have that experience of having dealt with and seen the aftermath of the Ebola epidemic. We have a question from Dr. Ahmed, who says, can we have some highlights on dealing with feelings of isolation and abandonment, particularly of that healthcare providers are experiencing?
Thank you, definitely. And in our situation, what we did was to make sure that there were clinicians that were available to work with healthcare workers, both in terms of working with them while they were going through the response, as well as and providing supports for them, as well as after the response, doing work around psychological first aid. And for those that had more severe mental health concerns, referring them to clinicians that could provide supports for them. And of course, healthcare workers are not immune from being also a person with a severe and persistent mental illness. And you can sometimes expect in a response, especially where people are having problems getting their medications and getting their treatments. I know many people on this call are doing telephone and internet therapies. That's largely unavailable in a setting such as ours. And so I think it's really important that you pay attention to the mental health care of your healthcare workers. Those who are intimately involved in the response, because you know they can threaten the response. And we had an experience where a healthcare worker had a mental health crisis right in the middle of the response. Those who are at risk of becoming have a severe episode, you need to work for them. And those people who just suffer burnout. And I don't mean to make burnouts just, but that is one of the issues as well, is that within the context of a response, it is not normal business as usual, even for a healthcare worker. And so the adrenaline is flowing, the issues are flowing, there are lots of lacks, as we've seen all over the world, in terms of lacks of PPE, lacks of access, lack of rest. And so being attentive to all of that and having avenues for which healthcare workers can self-identify or be referred.
Thank you so much. I want to turn to Paola Barberino now from Alzheimer's International, and particularly because of the vulnerability of older people to this disease, because of the extent of the spread in care homes in many parts of the world. There's a question from Eric Kaufmel about whether COVID-19 might speed up deinstitutionalization. Very many people get infected and die in institutions. What is being done to protect them?
Yes, it's a very good question. There's been a lot of debate about this in our community recently. We see it as one of these possibly positive outcomes. We have advocated for years about patient-centered care and about the fact that looking after people who are living with dementia at home is usually the best possible option. So we are having a lot of positive feedback actually about this. So as well as people that are experiencing difficulties, there are also people that are experiencing very positive sentiments about having a closer relationship with a member of their family. And this must not be underestimated. We think this will lead, hopefully, to greater and faster progress in this very area. Having said that, We have seen what exactly has happened in care homes all over the world, and not only in those countries that have formally reported about that, but also in many countries that haven't. And so we can't underestimate both the damage that hospitalization and being in care facilities has given to our constituency through no faults of those institutions that have worked so hard to make sure that the infection wouldn't spread. But again, this has caught us all unprepared. I think this is going to bring some really positive steps. However, we need to remember that in the case of people who develop dementia, which is a condition to which you arrived after developing 104 possible pathways to dementia, and one of them is Alzheimer's, which is the most common. Cases are so different from place to place, and the interaction with the disease is so different, and that's why having a diagnosis is important, that you really cannot generalize. There are cases in which this will be appropriate at different stages throughout the disease, and cases in which it may not. But certainly we cannot underestimate the amount of work and positive things that have been done. I also would like to praise the healthcare workers in care homes and in hospital, many of which have sent their testimonies to us in order to also reinforce the immense amount of work that many of them have been through without the assistance of protective equipment, for example. Thank you.
Thank you. Yasmin Mujahid, I want to put a couple of questions to you really about the, overall framing of the pandemic and how it might affect us as individuals. So there's a question here about what you think the term social distancing does to our psyche.
Well, yeah, I think, again, it has a lot to do with the lens we see the world. This is one of the things that I focus on a lot, is how you see what's going on around you. Do we see that we are disconnected, or do we see that perhaps this is an opportunity, as many have mentioned, to actually connect deeper with ourselves, connect deeper with a higher power, and connect deeper with our families. So it can really be seen. You can see the same thing differently depending on the lens with which you use. And so I think changing the lens to one of a more spiritually focused, but also a positive lens, really, really helps a person with their own mental health and their own psychological health.
Okay, but here's a really practical question then. Wenlin Behau said that, so in this family situation, how can we guide our children who might fear even sitting with family members who need to go out of the home to continue the daily needs?
I think personally, and a lot of what I teach, from a spiritual based perspective, is really, it comes down to trust in, again, a higher power. It's very, very difficult from a religious perspective to think about security without the concept of a higher protector. And so I think what from a spiritual perspective one could tell their children is that you are being protected by a higher power, by your creator, and so you don't have to be afraid. This are finding actual security at a time when things are so uncertain. Again, it is a matter of something that's invisible, something that's unseen. We don't know if someone has coronavirus and they're carrying it on their hands. It's an unseen thing, and so it's really about looking to something higher to make us understand that we are being protected, but from an all-powerful force.
Dr. Kestel's a really interesting point that I think Paul Farmer from Mind raised earlier about whether we're at a point where we are really going to overcome the stigma that can and has in the past surrounded some mental health issues. I want to put this to you from Ian Tully, who's with us via Microsoft Teams. saying that there are signs in Qatar that people are prepared to seek mental health support more readily than was the case pre-COVID, and we are reaching people previously very difficult to reach. Is there any evidence to suggest that we're normalizing mental health in the context of COVID?
Thank you. Thank you very much, and it's interesting to hear that from Qatar. I think that there is more conversation in a bit everywhere probably about mental health and the impact that COVID is having in the mental health of the population. That should make a bit easier to talk about. That's not enough, right? We need to go to see how we make that sustainable. It was mentioned before earlier by Janice. I mean, yeah, all the emphasis and the support that may come during the crisis may go as soon as it came. So how do we make changes that are sustainable over time? And so if there is an openness now to talk about mental health, what needs to be out there in order to provide support, to ensure that there is a continuity of a dialogue, that mental health becomes part of the normal life. It was interestingly, I wanted to comment before, and it's related to this, when Paola Barbarino was talking about the people in institutions following a question. It doesn't matter how well or bad institutions are managing the situation right now. What we need is to use this opportunity to build back better, what I was saying before, and to develop services in the community. People need to be in the community, not locked in institutions, whether it is for the aged elders or people with dementia or many psychiatric institutions that have been built historically and that has contributed to the stigma and the discrimination. Mental health associated with madness, with putting somebody out of the system in a mental institution. We want to bring that to the community. That is part of us. And building a system that is sustainable means bringing services to the community so that not only those in better wealthy countries could access that, but everybody can, no matter where they are again.
Paul Farmer of the charity Mind, let's talk for a moment about those who have been infected and who are recovering from this illness, and also about the general fear of being infected. On the second point, is there a worry for you that there's a societal fear or a different way in the way that we look at our fellow citizens? And what is the evidence about the kinds of support that people need when they are recovering from a disease like this, mental recovery as well as physical?
So I suppose it's important to stress that fear factor can certainly get in the way of stigma, and as other colleagues have mentioned, the phrase social distancing is almost completely contrary to the idea of social contact, which is what ultimately helps us to improve our understanding of our fellow human beings. So we do have to be careful about the potential for the kind of for society to fracture a little bit more as a result of people not really having that social interaction. And in these circumstances, we have seen examples of groups who are marginalised becoming more marginalised as a result of that. But it is also possible to create that greater sense of connection because of the shared experience that people are in. And I think there is certainly good experience from countries around the world where that coming together can create a greater sense of resilience and inclusivity. And I think on your second point, the kind of opportunity to really kind of bring communities together here is a great one, and we do need to think about how we can harness some of that opportunity, both in terms of the nature of the way that services are going to be provided coming forward. And we've Devorah Castell is absolutely right about the kind of opportunity to lead to greater integration of mental health services and people with mental health problems in communities. Here in the UK, quite a lot of mental health beds have been emptied in order to make way for non-COVID acute patients. So people are living in communities with mental health problems and being supported by services to and that seems so far to be going very well. So there is an opportunity to make the most out of this. But I think our communities are almost at this crossroads point about coming closer together as a result of this crisis, or potentially running the risk of becoming more fractured.
Sharifa Al-Amadi from the Doha International Family Institute. There's a question that's coming from Binta asking whether you have any counselling points for parents of children with special needs at a time like this.
I think, I said maybe before that the parents with the special needs, they have to put in their mind that this is like a special situation. They can ask help virtually, counseling, like even asking, like calling even in Qatar 16,000, so they can help them. All the centers like Shafallah and Family Consulting Center, also the Qatar Foundation for Social Work, already accepting the calls and working. They're still working to support these kind of cases. But still, I think it's very important from psychological point of view. The parents has to deal with the special needs like they used to deal with them. They have to use the same activities that their counselor used to tell them to do at home. If there is another activities that they have to do it out of the home, so like autism cases that they have to socialize. So this question we have to ask our counselor or our psychologist, psychiatrist, that they already following with us this child. Also, we have to take care about ourselves, like to give a time for our children, but to have more energy, to take a relaxation, to stay one moment with us, with ourselves, to still schedule our time. So give time for our children, our work, and ourselves at the same time. So if we will deal with all these activities that we use with it, we will be, inshallah, in a safe way.
And I want to come to each one of you, each one of our panel, because our time is coming to an end. So in a moment, I'll come to each one of you for a final thought, something to help people in different situations cope at a time like this. But before I do that, Dr. Janice Cooper, there's a question from Jamshan Pei about, given what you have seen with Ebola in Liberia, what will be the mental consequences of COVID-19, whether for infected or non-infected persons?
So I think you have to also bifurcate that infected and non-infected by people who've already had or have lived mental health experience, because that's the other component to that, both within those who are infected as well as those who are non-infected. And so I think if we want to think about what the consequences are, I think what we need to do is think about how we can prevent further mental health conditions, and for those who have mental health conditions, how we can make sure that their status does not deteriorate but improve. And what we have adopted as a country is the WHO Building Back Better. We don't want to do anything that we can build upon. And so recognizing what is currently in your system, where are the strengths, and to how you fortify those places where you have strengths, and where are the places in your system where you have weaknesses. So if your weakness is the ability to be able to leverage persons with lived experience so that they can also be part of your system writ large, your community system, they are not stigmatized and disenfranchised. If that is part of your weakness, you need to do something about it, because if they feel as if they are part of the solution, that is already one problem that you're solving. If you're listening to persons with both lived mental health experience and those who experience mental health conditions in times of trauma, because they're not always the same groups of people, You also want to make sure that their voices are amplified as you think about how you're building your system back. The other thing is that what we saw is that we definitely need psychiatrists in our country. You didn't hear me talking much about psychiatrists. We actually have 2 that are in country that are stationed here that are not affiliated with an international NGO of some sort. And so we rely on a cadre of mid-level providers who we call mental health clinicians. So making sure that you use the opportunity to build your system back, and making sure you use the opportunities to engage your citizenry while you're in what we call the peacetime. So that when we do have issues like this, that events like this that end up exacerbating the mental health conditions in the community and among persons with lived experience, you have something to fall back on. Okay, thank you so much. Well, we are just about out of time. People will be able to watch this discussion back, though, on YouTube, and I'll give those details in just a moment. But before that, just want to get a final thought from each of our speakers in turn, something to take away with us, a strategy, something to help people in the face of a continuing pandemic like this. Dr. Devorah Kestel from the WHO.
Thank you. I was thinking about 2 levels. On one hand, on the individual level is how do we do what we have been saying during the session? How do we take care of ourselves? How do we do things that will help us having a better mental health in current situation, and taking care of us and loved ones, and be kind to one another? On the higher level, governmental level, I have to repeat, let's use this opportunity to build back better, to make sure that mental health services are available for those who need it, to move from the institutions to the community, to make sure that there is mental health coverage as part of any health system in any country, mental health part of insurance, mental health part of the capacity building of the health workforce. We need to make sure that this is staying over time. Okay. Thank you very much for the opportunity.
And about 30 seconds each for our remaining 5 panelists. Paul Farmer from Mind.
So this is a journey of recovery for individuals who have experienced the illness, for families who have lost loved ones, for communities and for countries. And if we put mental health at the heart of that recovery at each level, the personal, the regional, the local and the national and the political, then I think we could come out of this enormous crisis a much stronger society.
Janice Cooper from the Carter Centre.
Thank you, and this has been a wonderful panel, and thank you to all fellow panelists. I think 3 things I want to say. In the peacetime, we need to work on self-care, self-care, self-care. I think we need to make sure that we understand there's no health without mental health, and your healthcare system will be undermined if you don't address the need for mental health. And the need to engage persons with lived mental health experience as you design and redesign your systems, I think are critical. Thank you so much for the opportunity.
Thank you, Janice. Let me turn then to Sharifa Al-Imadi from the Doha International Family Institute.
Thank you, Mishal. I think it's a very, very important thing that I don't like the term of social distance. We are physically away from each other, but we are contacting each other. We can talk to each other. We can communicate with each other. And the family unit is very important. So we can contact our family, our extended family. So it's easy. We can do it. So please don't call it social distance, because this is physical distance. So thank you very much, and it's a good opportunity to talk with all of you. Thank
you. And Paola Barbarino from Alzheimer's International.
Thank you very much, Mishal. Great to be on this panel. 2 points. One is practical. I noticed that our website didn't make the list of resources. So if you're caring for someone living with dementia, or you are a person living with dementias, please go to alz.co.uk so you can find about your local association and general help. The second point is about policy. I think this crisis has shown us that there is a need for a higher awareness of the right of people living with dementia and older citizens all over the world. This has shown how governments were vastly unprepared to deal with this. And I think this will give us an opportunity to bring the needs of that constituency to a higher level, and we will do that in the year to come. Thank you.
Thank you. And lastly, Yasmin Mujahid, writer and public speaker.
So a very important psychological principle is that what you focus on grows. And so while we are all going through challenges right now, we all are also experiencing blessings in our lives in different forms. And when you focus on your blessings, and this is something that's been shown in many countless studies, the practice of gratitude, for example, it really can have a very profound effect on our mental health and allow people to flourish psychologically and spiritually.
Thank you so much, Yasmin Mujahid, and thank you to all our contributors, those on the panel, of course, but also everyone who sent in questions or comments from around the world. There were many more than I could use over the course of the discussion, but they were all much appreciated. And you'll be able to watch this discussion back via the Qatar Foundation YouTube page, where you'll be able to find it if you search under the Education City Speaker Series. I am going to bring up now on the screen details of some organizations where you will be able to access health and support. This is not an exhaustive list, but these are some good places to go to straight away. So there's a global mental health directory via befrienders.org. You'll also be able to find information under the website of suicide.org. Mind, we heard from Paul Farmer, it's at mind.org.uk. Qatar-based WAAC.qa, and the World Health Organization's mental health information is at who.int/mental_health, and Paola Barberino's organization is at alz.co.uk, Alzheimer's International, which has organizations right around the world. So thank you all for being with us. Goodbye.
Bye-bye.